nurses, back with me, Dany, Imran, Mohd, Yunos, Group 26, first year, second semester, with topic 12, applying a spiral bandage. Today we're gonna show you how to bandage a patient using the spiral method. So enjoy the video and drop a like and subscribe if you enjoyed this video. Thank you! Now we're gonna do the spiral bandage procedures. I'll having the presence of my sister Raihani, and first off, as doctors, as nurses, we have to enter the room, knock the door, and sanitize our hands first. After getting into the room, we will ask, "Good morning.
Good morning.
My name is Dany Imran, and I will be assisting you to apply a spiral bandage on your legs. Is that fine?"
Yes.
Check the patient's name tag. Are you Raihani?
I am.
Your patient medical file states that you will be needing a spiral bandage, so I'll take my time to prepare the equipment. Are you fine with that?
Yes.
Great. The next step is that we will gather the equipment, and we'll be needing a 4-inch bandage, scissors, and of course we need plaster. And we have to prepare the plaster beforehand, especially if we don't have a second nurse or a third nurse to help us with this procedure. So I'll be taking the plaster and prepare the plaster beforehand. The next step is for us to lift the patient's leg. If there is no second nurse to lift the patient's leg, we can use a pillow to support her leg. Of course, stay away from scissors or sharp pointy objects away from the patient. Use the pillow to support the patient's leg. I'll be lifting your leg. Are you okay with that?
I'm okay.
Great. After lifting the patient, now we can move on to the next step. Once you have your roll, make sure that your roll is facing towards you. You don't want to use like this, but you want to wrap the leg according to this direction. Now we'll start on from the first roll. The first roll will be rolling it twice. Not like the others. The one that we require to be rolled twice is the first initial loop and the last loop. I'll be starting on making the spiral bandage on your leg. Are you fine with that?
Yes.
Please tell me if it's too tight or if it's too loose for you, alright? If it's painful, do it informally. Alright? Okay, good. Then we'll place the bandage and we start on wrapping the patient's leg. Make sure to do 2 loops. So this is already 1 loop. And then the second loop. The next step is we'll be using 1/3 towards the inner side and 2 at the outer side. And make sure when you're doing the bandage, make sure it's proper and tight, but not too tight, just comfortable. You see, leave space 1/3 of the bandage. So we'll be using that loop. And make sure for the final loop, you'll make it twice. And once you put it, make sure to flip it into the inside and make sure to tape it. Are you feeling comfortable?
I'm comfortable.
Is it too loose?
No.
No. It's not tight?
No.
Great. It means that I'm doing a great job. Then take the tape and make sure to tape it. Next, make sure you have a proper good communication with the patient and asking about the patient's comfortableness. Are you comfortable?
I'm comfortable.
It's all good?
Yes.
Great. I'm really grateful that you gave your good cooperation to me. Afterwards, make sure to keep all the equipments away from the patient and leave the patient as comfortable as you can. Make sure to use hand sanitization and sanitize your hands once leaving the room. And make sure to document, as we want to let other nurses know when did we put on the bandage for the patient and for the next fresh bandage to be used on. So we'll take away. Thank you, Raihani, for giving your best cooperation.
Thank you, nurse.
And that's all how us as nurses or doctors should apply a spiral bandage. As you can see, it's spiral and it should be always 1/3 and 2/3 the other side. Make sure to loop the first loop twice and the last loop it twice. And make sure that it looks comfortable, tidy, not too tight, not too loose. And that's all from me, Dany.